I'm Dr. Abhinav, MD in PMR, Physical Medicine and Rehabilitation, and I'm a physician. And earlier I was working as a consultant, as a faculty in a medical college. Now I've started my own setup. And when you are working as a faculty, there's always a thing that you have to take care of, is that there is no one above you to cross-check what you are doing. One of the best way to cross-check is to go for the review of literature. Review whatever you are doing, keep cross-checking what is happening in the literature, whether you are on the right path or a wrong path, or there is any scope of improvement. So this was a sequelae of a spinal cord injury patients where evidence-based rehabilitations are needed, and what should be the approach, how we should approach those patients, and what are the physical, neurological, psychological sequelae that leads to a spinal cord injury. And whenever all the juniors who are sitting out here, remember, any department, any medical department or specialty, they all have a direct or indirect role to play when a patient has a spinal cord injury. So what are the sequelae and what are the rehabilitations that needs to be done? The sequelae is mainly, it starts from the moment patient is in the ICU. A, B, C, D, okay, well done. Then comes the pressure injury. How much time a pressure injury takes to develop? There are case reports which says even 5 minutes pressure injury will become activated. So we have to be always careful. You will see that patient is in ICU and on air mattress and everything, and still they have this problem of pressure injury. One of the reasons for this is delayed rehabilitation, because we think, okay, we are on the life-saving mode. Yes, we have to save the life especially post-operative cases. People are over-cautious that the implant should not get dislodged or there should be some pulses or something should come out. So these are the patients which we have to be careful. Keep mobilize whatever you can mobilize. That is the best way to approach. Whether it is a lower limb or upper limb, whatever the critical, in coordination with the critical team, you should mobilize it. Suppose if a patient is a long time on the bed, these patients are at risk of developing DVT, deep venous thrombosis, because mobility is not there. Again, mobilize the joints as much possible. These patients may develop contractures, and once a patient has a spinal cord injury, bowel, bladder involvement will be always there. There is one more injury which people tend to miss, is autonomic dysreflexia. It is especially in those patients who have traumatic level T6 or above. If these are the patients, they do develop any noxious stimulation below the level of injury. These patients will have hypertension, profuse sweating, and everything will come up. And the moment it comes up, it is an emergency and it is an alarm. So we have to be always cautious. Even UTI, which is common in these patients, that can trigger autonomic dysreflexia. And always, whenever you are giving any therapy to any patients, be careful. The therapy has to be clinically monitored. You can't give it. Can you see this? This is a HO, a heterotrophic ossificans, which a patient has developed because of the wrong therapy, microtrauma that is happening with these patients. Many places, these patients do get this TENS. TENS, please be careful. TENS, level of evidence is very, very, very poor. So, other than that, these TENS, you are giving an electrical stimulation and patient has loss of sensation. They may have a burn injury. So, we have to be cautious whenever we are taking care of any patients anywhere. What about the love life of the patient? What about the sexual life? That has to be taken care of in rehabilitation. Whether this couch, yes, there need to be modification in the bed. Everything has to be taken care of. Can these patients of spinal cord injury go and play the basketball, rugby, badminton? Yes, if rehabilitated properly. But one more important thing is taking care of the psychological factors. The moment a patient is walking, running, now within fraction of seconds, he will lose everything. So that part has a very big impact on the psychology of the patient's low mood, hopelessness, helplessness. We have to help those patients come out of it. So whenever we are working with any patients, we have to take care of every aspect: physical medicine, physical modalities, physical therapy, assistive technology, prosthetics and orthotics also has a role to play, and the vocational rehabilitation has to be taken care of. Mind, body, soul has to be managed. And this is one of my patients. If we do a proper rehabilitation, and he is a national rugby player, he is with the award, and I am showing this photograph with a proper consent of the patient. Can you imagine he is a spinal cord injury patient? Sorry. So if you train these patients properly, tell them this patient, if you look, he is always at the risk of developing pressure injury. How he is at the risk of having fracture of the lower limb. And in spite of that, he is managing because he has been rehabilitated well, and he is managing. Can you look at the cushion that he is using? It is for the prevention of the pressure injury. Proper quality of cushion also matters. Everything matters. And this patient also sells fish. He sits and sells fish. Every 4 hours he is doing CIC, continuous intermittent catheterization, intermittent clean catheterization. So if we do a proper rehabilitation, properly managed, properly taken care of, in coordination with all the specialty. As I told you in the beginning, every specialty has a role. If suppose a patient is a female and has a spinal cord injury, can she become mother? What are the hormonal changes? But what are the precautions? Lower abdomen is weak. So we have to keep monitoring. But yes, as ma'am said, yes, we can. So there is a lot of scope. Only thing which I tell all my patients with a spinal cord injury, ट्रैफिक जाम है, हाईवे जाम है, बट देयर इज ऑलवेज अ शॉर्टकट. छोटा रास्ता हम पकड़ेंगे, थोड़ा देर होगा, डिले होगा, बट वी विल रीच समवेयर. थैंक यू.